You, Jess. All right, we're good. That's that. Okay. Let's go over to our KWAM News Zoom room. Keep it here, and we'll break bread with Dr. Michael Alm of the Physicians Advisory Group. Good morning, Doc, and thanks for joining us in between clinic. Really appreciate it.
Hey, morning. Glad to
Good
be
morning.
here. Thanks.
Looking good. Loving the hair.
Thanks.
I guess just first of all, does it feel good to be back at work?
Oh yeah, it's really nice to be back. You know, being in quarantine and not being able to go to work was just kind of
Right.
a bummer.
Right.
You know, and now that everybody's on lockdown, everybody else knows how that's we're feeling all of that. So
Dr.
good
Wen
to be back.
had said something about you guys were doing some kind of testing, COVID-19 testing. I know he name dropped your clinic. Can you tell us anything about that?
Oh, I think you might be mentioning he might have been talking about the Abbott ID Now machines.
Right.
So there was a bunch that we got through the CDC. I think about 10 was the first batch, and they sent it out to the clinics that were already doing the swabbing. And now there's, I think, a few more still left that we can get out. So we got one for GMH to kind of help test some of the patients that come in, since we're doing everybody in the ER. Now we're trying to expand it to, include like pregnant moms and such. And the benefit of this Abbott ID Now, I'm sure a lot of your listeners are already aware of it, is that it's similar to a PCR. It's a molecular test. Will amplify the viral particles, and so it's very sensitive. And the benefit is that we can get results back within about 15, 20 minutes. The downside is we can only run one at a time, and so it's great if we have a symptomatic person that we need to know the answers right there to find out. Not so great if we have uh, 6, 7 people want to get tested all at the same time, because then it takes a while for it to run.
But this is just for we're right now. Public health is just only wants symptomatic people to get tested, right? And it's only for target testing.
Yes. Yeah. From the community testing from what was it now last week?
Yeah,
Oh man, time
two
flies so
weeks.
fast. We were so backed up with testing, and now I think DLS might be running out of, or they're waiting on the shipment of reagents.
Mhm.
So we're hoping that the Abbott ID Now can kind of help offset some of that load. Clearly, we can't do the same amount of volume. And then we're really trying to prioritize, or public health wants us to prioritize, symptomatic and direct contacts. Um, I know that a lot of people are getting asked to get tested from like their work for possible exposures, and we're still doing that, but those results just might not be prioritized when they get to the testing labs.
Mhm. Dr. M, what do you make of the numbers specifically for the young adults, but even more so the children? Because we're
Right.
still seeing a lot of kids testing positive for COVID-19.
Yeah, yeah, it's I think it just reflects on how widespread this virus really is in our community, right? Where through empiric research that it's been going on since the pandemic started, we're seeing that young kids are generally not the first ones to catch it in the household, which means it's coming through the adults, which makes sense. People are locked down, and parents are the ones going out to get groceries, etc. They're probably going to be the ones getting exposed and bringing it in.
Mhm.
And now that we're seeing how widespread it is, it's just kind of filtering down, and now we're seeing more cases with children. Thankfully, and I think I've mentioned this before, 95% of kids will do pretty well with COVID. With documented cases, we're seeing that worldwide, about 5% will need oxygen or hospitalization, but 95% will have no symptoms or mild to moderate symptoms. So thankfully, that's the one bright spot in all of this.
Right.
There is one condition though to kind of keep an eye out on, and we're going to start. I'm working with public health, my wife and I, to starts a surveillance program for this condition called MIS-C, so multi-system inflammatory syndrome for children. And it's a relatively rare condition that, hopefully, it'd be great if we never saw it in Guam, but it's something we have to kind of pay attention to. And it hits not right when they get COVID, but a few weeks afterwards. And so in the UK, when they first saw this, they saw it in April, which was a couple weeks after they had their first wave. And so our second wave now has been about a couple weeks now. So in the next 2, 3, 4 weeks, we're going to be spreading the word to pediatricians and family medicine doctors to really keep an eye on this.
Doc, as a parent, you said 95% of kids will just breeze right through this, but I focus on the 5%. What types of conditions that we look out for kids having that causes them to struggle with the COVID?
So any underlying illness, I think we talked about this in one of the interviews, like I think when I was actually had COVID, right? So obesity is coming to be a big factor. I think there was recently an article, in a few news outlets that showed that obesity in men specifically, really increased the risk of a more severe case and increased risk of death. So, you just got to extrapolate the data, right? So, obesity in kids, any underlying conditions, any chronic kidney disease, any chronic conditions are going to be kids that are a little bit more vulnerable, just like they would be in the adult population. So
Asthma?
we really need to do a good job of keeping them safe.
Mm-hmm. Yeah. Have you seen any kids with COVID? Have you treated any at your clinic? And if so, how severe?
Oh, yeah. Actually, yes. And, it's amazing how well they look. I remember the very first child I saw with COVID was actually in the ER at GMH. And, they called me down and the parents were positive. So they thought the kid was positive. And the child was probably, just over 3. And all they said was, you didn't really have a fever. I think he coughed once or twice last night, threw up once, and he looked fine otherwise. And he tested positive. And this child looked fantastic. He was running around. I was all in isolation, trying to chase after him to examine him. And he looked great. And then they followed up with me 2 weeks later at my clinic. And I asked if any other symptoms happened or anything. And they said, no, that was it. And so that they can look that well. And that's probably a big reason why the child numbers worldwide have been pretty low, just because when they look that well and we're short on tests or a particular stage short on tests, they're not going to prioritize such a well-looking patient. Mm-hmm. And so the numbers for kids are likely higher, but we also know that they tend to do better even if they have documented COVID.
Is it hard to see those cases, Doc, where it just goes south because the kids have these pre-existing conditions?
I haven't seen any PEDS cases at GMH so I think we might have had a couple kids test positive, but as far as I know, we haven't had a kid in the ICU. But, I'll be honest, I'm on call tonight at Florida Hospital, but I haven't been on call in a couple of weeks. And so I don't.
I'm sure you would have heard something though.
Right?
Yeah.
You said,
I feel like we would have heard something through the pediatrician chat group, but no, haven't. So kids have been thankfully, for the most part, spared from this on Guam so far anyway.
You said, did you say mix or the illness that we should be looking out for? Was it mix?
Oh,
multi-syndrome?
MIS?
Yeah.
Multi-system inflammatory syndrome.
Somebody's asking if that's the same as Kawasaki disease?
Very similar. It looks very similar. Right. And some of the key factors that kind of overlap, about 5 days, anywhere from 4 to 6 days, but 5 days of fevers for Kawasaki's, and then you can get a rash, some pink eye, swelling of your lymph nodes, swelling of your hands and feet. One thing that kind of makes it a little bit different is that with MIS, there's a very high percentage, depending on what studies you look at, 60 to 100% will have GI symptoms. So they'll have, either abdominal pain, vomiting, diarrhea. And then the age group, typically, from what we're seeing in the States, tilted a little bit older, so more like 8 to 12, although they saw a range from the very young to teens. Whereas in Kawasaki's, we typically see that in the younger kids, maybe like 3, 4, 5, with a predilection for those of Asian descent. Interestingly, I haven't come across any studies from any Asian countries that have picked up on MIS, and the studies that mostly we're working off of have been from the UK and from the States.
But we haven't had any cases on Guam, right? But...
there's none that we can say for sure.
Right. I was working on a story.
They say it's a spectrum.
Yeah, I'll just share with you. We were working on a story. We had got a tip that a young boy had passed the COVID, and that on the death certificate it had said that multi-inflammatory syndrome, but they later went back and changed the cause of death. And and of course, just being in the news, I was like, well, this is just crazy. But I spoke with a doctor who coded the boy. I mean, so sad, and he stood by the change. So it is what it is,
Yeah. I was actually the primary attending on that child. And I can't go into details
Right.
because of HIPAA,
Yeah.
but as we're talking about the surveillance study, one of the things that we wanted to do was kind of go back to that case and kind of look, that child did have underlying medical conditions.
Right.
And so it really fuzzies the picture a little bit, because one of the criteria for MIS is there should be no alternative plausible diagnosis. And he clearly had one that could have gone, clearly contributed, but was it, what did COVID make a difference? It's hard to say.
Doc, we had Dr. Ann Pobutsky on, the territorial epidemiologist, and she kind of did a mic drop on the schools, and she was referencing these numbers that we're seeing with the young people, 20 to 39, but then she also touched on the numbers that we see with the 0 to 19 year olds. And what did she say, Bree? There's no way
No, she said no way, but we probably shouldn't even be having school for the
rest of the year.
Yeah.
Yeah.
It's really tough to forecast the future, but with our current, rising cases, it's going to be a really tough environment to open up. Just if, we keep seeing staff at schools get test positive. I mean, staff in the hospital are testing positive,
Right.
and everything's kind of come ground to a halt right now.
Was that a discussed during the PAG last night?
As far as schools, no, that wasn't discussed. Well, the big issue last night was, the hospital is really close. It's very understaffed right now. We're losing a lot of staff due to, positive contacts, and then of course they need to be taken out.
Right.
And so, Dr. Jolene Uggen is really just working so hard and so tirelessly. And really, when this is all done, you guys, the whole island really owes her a huge debt of gratitude for her work that she's done. But yeah, she's doing the best that she can, and they're pulling people in where they can and really just trying to make this happen. They opened up, I think, what is it, Care 5 now in the hospital.
Right.
So, but even I was just looking at the census, and even that one is almost full, just because we have the physical space, we just don't have the staffing, and staffing is not just something you could just throw money at to get more nurses.
So what is the latest count of staff at GMH that have tested positive for COVID?
Sorry, could you repeat that? Didn't quite catch that.
What is the latest count of the medical personnel staff at GMH that have tested positive?
I don't have the exact number. They give us a daily bulletin kind of how many tested positive. I thought it was something in the 20s.
At GMH?
But it's not at GMH.
Yeah.
I could be wrong.
But that would be for the duration of the pandemic, right? Not just 20 pop.
Yeah, I
like
think
last
so.
week.
Yeah,
Okay.
yeah, I think so.
We can follow up with Lillian.
But
if you don't.
the problem is, just contact trace, like the contact tracing part. So if people get exposed, then we have to do.
You have to
out
sideline
of the rotation.
Right.
Yeah. And that makes
So,
it difficult.
so you're confirming that the sidelining of nurses who have come into contact with positives, it's hampering the hospital operations, obviously.
Oh, absolutely. I mean, and it's not just the nurses. I mean, Dr. Uggen was saying, she's having trouble getting nurse assistants, the ward clerks, janitors are out. I mean, it's not just doctors and nurses running the hospital, right? It's
Right.
just
Yeah.
so much staff.
Wow, Doc.
Oh,
Yeah, it's very, it's such a overwhelming feeling, to just hear that this is exactly what we feared right in
Right,
March, that the
right.
hospital would be overwhelmed. And
So how do you
we're
keep
there.
going? How do you get up every day knowing that we're in this? Everything they predicted. we're here.
It really helps to have good support system. So I'm so grateful that my wife, is also a pediatrician, understands what I'm going through. And then having non-medical friends is also just a godsend. Just to sometimes I just gotta let it out and just not have to respond with a medical mind and just
The
relax a little bit.
WTFs and
vent
all
some
that,
steam.
right? Like,
Yeah, but they're probably like,
Yeah.
but what about this? But what about this?
Yeah,
So you
yeah,
have to
that
say
definitely
no
happens, but,
COVID
you know,
conversations.
hey guys,
sometimes they'll just let me vent, and you know, I'm so grateful to have
nice.
those friends.
I bet sometimes though you're like, hey guys, no COVID questions after 5 p.m. All right, because I got doctor friends and they're about to block me. Well, Doc, thank you for your time. Anything in closing? Because we.
Sorry, one
sorry.
quick question.
Okay.
I think we talked last time about because there was a story we did about a mother who was at the quarantine facility and they made her baby get tested,
Yeah.
and so there was some conflicting and some
Oh, yeah.
clarification that were needed in the DPHSS guidelines. Do you know if there's any update on that? On I guess the age of testing is required.
I didn't
for
see
minors?
any updates on that. And that, you know, to be honest, you know, our focus kind of shifted,
Mm-hmm.
you know, with the past couple meetings, just with, you know, trying to deal with
Right.
The
huge
surge,
rising
yeah.
cases.
Yeah.
So yeah, I don't know, and that would still be up to public health, you know, discretion, I suppose.
All right. Well, thanks, Doc. Stay safe.
Yeah. Thank you, Dr. Be safe.
You guys too.
Wear your mask.
All right,
Wash your
thanks,
hands.
guys.
Okay.
Of
we'll see you.
course.
Yeah.
Thanks.
Okay. 9:43. Dr. Michael Lum of the Physicians Advisory Group. We're gonna take a break and come back and close out the show with news. Next here on the link, it's The Breeze 93.9. Good morning.